on medication for chronic lifestyle diseases usually suffer from sleep disorders. Here we take the case of a patient who was suffering from poor sleep, who had airway blockage and needed the help of a CPAP machine to sleep, and was on multiple medication for hypertension, diabetes, high cholesterol, liver disease for many years. Here we see how clinically supported lifestyle correction helped the patient to sleep without the CPAP machine, without snoring, while simultaneously helping in reducing and stopping multiple medications for hypertension, diabetes, high cholesterol, liver disease, etc. We also learn how long it took to overcome the discomforts and symptoms, how lab tests helped monitor the progress of body and disease parameters during the treatment, and time it took to bring HbA1c, SGOT, SGPT, etc. to normal levels. This series is about my experiences with the patients who took clinically supported lifestyle correction to avoid surgery and taper off medications. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on undergoing surgical procedures or continuing with lifelong medication. To know more about different lifestyle diseases, treatment options, reversal of lifestyle disease with lifestyle modulation, etc., you may search our YouTube channel. When we come to the details of this patient, he is a male, 47 years old, height 166 cm, weight 94 kg. And when we come to the medical history, he is having sleep apnea on CPAP machine, he is obese, he is on medication for diabetes, fatty liver, hypertension and high uric acid. When we come to the family history, his father and mother had diabetes, hypertension and dyslipidemia. Next we see what are the symptoms and blood parameters, etc. before starting the clinically supported lifestyle correction. His main symptom was, one is he's having palpitation and also there is discomfort, that is dyspnea while he is doing some work like climbing stairs, etc. And he was suffering from anxiety. Gastric problem, gas and acidity problem was there. And he was diagnosed with GERD also, that is gastroesophageal reflux disease also. And he had allergic problem like sneezing and sleep apnea and snoring. Sleep apnea, he was using a CPAP machine. If he is not using the CPAP machine, he says a very loud snoring problem was there. And his skin has a discoloration on the face and the foot, darkening of the skin was there. And also balding, that is hair loss, that is male pattern hair loss was there. Next we come to the medications, what all medications he was taking. That is, he was taking bisoprolol, rosuvastatin, bisoprolol for the hypertension, rosuvastatin for the cholesterol, and urodeoxycholic acid, that is for the fatty liver, and pregabalin, that is usually given for this neuropathic pain and psychiatric problems, anxiety, or some psychiatrists also give. Maybe he's taking that also. And metformin, that is for the diabetes, Polistar, Evion, vitamin D3 tablets, and methylcobalamin. That's some vitamins, food supplements also. Next, when we come to the blood report, his HbA, even though he's on medication for diabetes, his HbA1c was 7.5 and glucose is, blood glucose is 177. Insulin and C-peptide level is normal. That means his pancreas is functioning properly. That is enough insulin pancreas is producing, and that means it is a type 2 diabetes. So it is type 2 diabetes. If the patient with the lifestyle correction, you can fully reverse the situation. Then the cholesterol is, even though he is taking statin, his cholesterol level was very high, 321, and triglyceride also high, and the uric acid also very high, 10.05. And liver function test, SGOT and SGPT is very high. SGPT is 131. He's not an alcoholic, even though that means he's having his hepatitis is there. And albumin also high, vitamin D deficiency, 17.5 only, and HSCRP, it's a cardiac marker actually, it's an inflammation of the blood vessels, this HSCRP means, and it is also high, and also vitamin IgE, that is allergic response is also there, 524 is there. Then when we come to the ultrasound scan, usually before starting clinically supported lifestyle correction, we go into the details of the blood parameters and also body parameters, and also ultrasound scan. Ultrasound scan doesn't have much of the side effect like radiation, X-ray or anything. So it's only a sound waves is used, it's safe. So we do a abdominal ultrasound scan for almost all the patient, and this patient is showing that there is grade 2 fatty liver was there, and also this benign prostatic hyperplasia was there. And when about the Doppler studies of the heart and the carotid arteries with the CIMT test, the carotid arteries shows that there is atherosclerotic plaques are there. And that means that the carotid artery is the artery supplying the brain actually. So it's a comparatively large artery, and it can be checked with the ultrasound itself for aging, assessing the aging, vascular aging. And the aging means actually when we call heart block, coronary artery block, and all, for which we use stent and bypass surgery, etc. That is this fat accumulation inside the blood vessels actually. So we cannot check directly how much it is there in the coronary arteries, but we can look into the carotid artery. So carotid artery, if there is atherosclerotic plaque is there, definitely in other arteries, especially in the cardiac arteries and all, there will be atherosclerosis will be there. That means there will be block. That may be the reason that he maybe his heart also, his coronary artery is also affected. That is why he is having exertional dyspnea and palpitation, etc. Then when we come to the final diagnosis, his diagnosis, he is having obesity and diabetes, hypertension, and NASH, and with a fatty liver grade 2, sleep apnea on CPAP machine, and high uric acid is there. And he is having palpitation and dyspnea. That means he may be having some cardiac heart block also, because the atherosclerosis is there. Then acidity and gastrointestinal problem, especially acidity is there, and allergy means especially in the sneezing, morning sneezing is very discomforting for him, and anxiety problem, and balding, that is hair loss, and skin discoloration. After that is all actually, many of these things are actually reflecting other body, the manifestation of the disease. When the blood vessels are affected, the circulation to the leg also will be affected. Along with that, there is sleep apnea and oxygenation problem and the circulation problem. That is the reason he is having this discoloration of the face and the leg. Next, when we come to the category of the disease, this is a metabolic syndrome basically. Metabolic syndrome means diabetes, hypertension, dyslipidemia, and obesity. And the other manifestations like sleep apnea and the fatty liver or NASH, it's all actually the complications of the metabolic syndrome. Next, when we come to the clinically supported lifestyle correction, first we should understand that what is the difference between clinically supported lifestyle correction and self-lifestyle correction. Everyone try to, when you are obese or diabetic or hypertensive, even the first line of management is correcting the lifestyle itself. Only when someone fails to correct the lifestyle, doctors start prescribing medication. That if you are, this all comes under the lifestyle diseases. If you are taking medicine, or if you are advised to take medicine, that means you fail to correct your lifestyle. So the understanding of each person about the correct lifestyle will be different, and the support also will be different. So if someone is needing to take clinical this medication for this lifestyle diseases like diabetes, hypertension, heart disease, etc., your lifestyle correction part is inefficient. In clinically supported lifestyle correction, with a clear direction, you will be advised to take optimal nutrition, optimal exercise, and minimize the toxins going into the body. So if these three things are get corrected, this body composition, the body composition should be get corrected. In this obese patient, there will be excess fat in the body, and that will be acting as a poison in it. And there will be maybe other heavy metals and so many other toxins. Even the glucose itself is a toxin. For a diabetic patient, glucose itself is a toxin. In this clinically supported lifestyle correction, what we are trying to give the optimal lifestyle pattern for the patient and advise the person according to each person's body parameters. That's why a detailed blood test and body parameters assessment, etc. are done before starting it. So that is, if a person is not able to do correctly, even though we may be thinking that many will be doing, I'm doing exercise and I'm daily working out in the gym, but even though I am taking so many medicines, that means your workout or it is not your food pattern and your working out is not ideal for your body structure and genetics and etc. So we had to study that, then correct the body parameter. Then we will be able to come out of the medications. Next is, before we start this clinically supported lifestyle correction, because it is a low calorie, low carbohydrate diet as for this obese patients, the diabetic medicines will be stopped from the first day itself. Otherwise, if the person is taking insulin and diabetic medication, the patient may go into hypoglycemic attack. Hypoglycemia is actually more dangerous than the hyperglycemia. So for all the type 2 diabetic patient, if the insulin and C-peptide level is normal, stop the diabetic medicine in the first day itself. And other medications will be stopped gradually according to the, for example, BP medicine, every day checking BP 3 times or 4 times, and accordingly gradually reducing. And also the cholesterol, every week we check the cholesterol and triglyceride, etc. And according to the improvement, that also tapered off. Usually within a month we will be able to, if the patient is cooperative and patient is able to do the lifestyle correction as advised, almost all the medicines will be able to stop within a month itself. Next we will see what are the changes which has happened after with the clinically supported lifestyle correction. First we will look into the symptoms. What was the symptom improvement or reduction? The palpitation, this fast heartbeat and all, was reduced by the 80% by the 8th day. So after starting day 1, then day 8 and day 15, 30, 60, 90, that is the pattern we direct follow-up visits actually. In between we follow up the patient with the telemedicine, and on after first day, 8th day, they will come again. By the 8th day when he came, and his palpitation, anxiety, gastric problem and acidity, sneezing, etc. almost 80% reduced. And he was continuing with the CPAP mission, and by the 15th day, actually his palpitation is completely gone, anxiety is reduced to 80%. Actually, by the 8th day, anxiety was reduced to 50%, and now 80%. And gastric problem, acidity, sneezing, sleep apnea, etc. is gone actually. He was not using a CPAP machine by the 15th day, but he had mild snoring was there on the 15th day, but by the 30th day the snoring also has gone, and the skin discolorations reduced, started fading away by 30th day, because it will take some time for this skin discoloration the changes to be evident. And by the 30th day, there was actually no symptoms, discomforts, only that skin discoloration was there. And by the 90th day, the skin also has become normal. That darkening of the face, cheek, and this foot was also got corrected. About the balding, it is persisting like that. But small hairs, some of the few small hairs started coming up. So for the balding, also, if it is in the early stage with the clinically supported lifestyle correction, you have seen that many patients, especially younger age group, and only 3-4 years this hair loss started. In such patient, you can completely recover, provided everything depends on the patient, how much the patient is cooperative and try to correct the parameters about the lifestyle. So even this balding can be even prevented, or some early stages can be reversed. Next, about the medications when we look into, and when in the beginning he was taking almost 9 tablets was taking, and for the hypertension, cholesterol, fatty liver, and this neurological medication, pregabalin, maybe for his anxiety, and diabetic medicine, and few food, nutrition supplements also. Except this bisoprolol half tablet. This bisoprolol is for the BP medicine. He has reduced it to half actually. All the other medicines was over. This diabetic medicine and the food support and nutrition supplements are all stopped on the first day itself. And the other gradually, actually this patient, he was not asked to stop this rosuvastatin, but he over those years he just stopped the rosuvastatin also. He just wanted to get rid of. He took actually he was asked to stop only the diabetic medicines, and gradually only we were planning to stop this statin etc. But he abruptly stopped it. Only the bisoprolol was taking, and by 15th day he was not taking that. By the time BP was normal, so bisoprolol also stopped. When we come to the blood report, HbA1c was 7.5, but on the day 8 his HbA1c came down to 6.9. Usually HbA1c is checked only in 3 months, but in clinically supported lifestyle correction we check the HbA1c every week initially and then every month, because if the patient is doing correctly, it will very fast, it will be corrected also. So almost 0.6% it was reduced, and by the day 15th it is 6.7, day 30 it is 6.3, and day 60 5.8, and day 90 5.5. So it has come down to normal by day 90. And glucose level was 177 initially, and the next day itself it has came down to normal with the patient is checking at home. And after stopping the diabetic medicine every 4 times in a day initially, and when the blood sugar is stable, then it is reduced to 2 times and once in a day, or like that. This cholesterol was with the medicine, his cholesterol was 221, but even though he stopped abruptly, it was reduced from the next 8th day itself, and it is gradually 8th day 308, then 309, and then 240, and by day 60 it is 228, and day 90 205. Then triglyceride level, it was the 8th day itself it came down to 194 from 253. HDL level was normal, and it is continuing like normal. And uric acid, actually it was more than 10 in the initially, and the 8th day itself it came down to 8.4, and then by 60th day it came down to 5.6. And SGPT are 131 initially, and then 104 on the 8th day, and 74 to 15th day, and 30th day SGOT and SGPT came down to normal. And albumin also, that is also a liver function test marker. And vitamin D, of course we are giving supplements also, it is checked by 30th day, it is 30th day it is also came normal. And HSCRP, this is a cardiac marker also, an inflammatory marker, that came down to normal in the 8th day itself. And the next is actually this mercury, antimony and tin, that was high for this patient. That is, toxic elements was high, and that also actually usually we check it only by the 90th day, 3 months, after 3 months. That is, mercury and antimony was come down to normal, but the tin was more than 25. It was maintaining like that more than 25, because we don't know the exact value. Most probably that might have come down, but it is not reached normally. When we come to the ultrasound, that scanning parameters, he had a fatty liver initially, grade 2 fatty liver was there, that actually came down to grade 2 fatty liver to grade 1 fatty liver by the 90th day. And this Doppler studies and this CINT test, this carotid intima media thickness and atherosclerosis, initially it was 1.3 millimeters, and it came down to 1.1 millimeter by the 90th day. Next, when we look into the body parameters, his weight was 94 initially, and his BMI was 34, and BP 120/80, and abdominal circumference was 105, and body age is 64. Actually his real age is only, calendar age is only 47, so accelerated aging was there, and fat percentage is 30.7. That is, for ideally the gents should have only 10 to 15% fat in their body. So the fat was so high. So it is reduced to, weight was reduced to 86 by 30 days, and gradually it is come down to 74 by 90 days. So almost 20 kg weight reduction in the 3 months itself. And BMI also from 34 to 27. And BP was normal throughout. And abdominal circumference, mainly this abdominal obesity that is actually creating this fatty liver, also connected with that. And his abdominal circumference was 105, it just came down to 89 by the 90th day. And body age, he was accelerated body aging was there, 64. By the 90th day, it came down to 51. And ideally, that is, again, 4 more years he has to come down. By the end of the 6 months, what we are expecting is to come down his weight further, reduce his weight further to around 60 kg and BMI to 22, and this abdominal circumference around 75 centimeters. And that means almost 30 centimeters. So you had to change your wardrobe also. If you when obese patient, when they are doing this clinically supported lifestyle correction, they had to, by the 3 to 6 months, the whole dress has to be changed. Actually, it would not be, the older dress will not be useful at all. And body age, ideally, it should be brought down to around 40 years. So 7 years younger than the normal. That is expected, but now only 51. He has come down to 51 from 64. That is 13 years in reduction in 3 months. And it is not just in the values alone. It is the patient will really feel that youngness and the improvement in the health and activity and flexibility and everything will be changed. And fat percentage is come down from 30.7 to 22, and ideally again she has to reduce more fat and come down to 15%. Now we'll see what was the changes, what is the real changes the patient had or experienced with the before and after. Before, the patient is having so many symptoms: palpitation, anxiety, gastric problem, allergies, sneezing, sleep apnea, can sleep only with the CPAP, and skin discoloration, and so many problems. But after this 30 days of clinically supported lifestyle correction itself, the whole symptomatic relief was there. Only the remaining symptom is balding, male pattern balding only, hair loss only. And next, medication, he was taking around 9 tablets every day, and there's no tablet by the 15th day. There is no medication. And blood parameters, actually before, so many blood parameters were abnormal: dyslipidemia, glucose was high, HbA1c, uric acid was high, liver function parameters was abnormal, and even the toxic elements was there. All these parameters were corrected, except the tin value only, this toxic element, that is a metal actually, that blood value was high, remaining high, but after some more time most probably it will also come down. Next, with the ultrasound scan also, the fatty liver grade 2 came down to grade 1, and prostate enlargement 28 cc was the prostate volume. It came down to 26 cc by the 90th day, and atherosclerosis thickness was 1.32 reduced to 1.9, and body parameters also from 94 kg to 74 kg. So, and body age from 64 to 51, and fat percentage from 30.7 to 22. So many changes are taking place. Not only that, when you had to get out of the disease, your body has to get corrected. Actually, this body parameters correction is the focus in the clinically supported lifestyle correction. This obesity and this abdominal obesity, he was 105 initially and 89, and I want to bring ideally, for the ideal setup, he has to come down to around 75 centimeters. Next, we will see what will happen if the patient was continuing with this clinic, the traditional treatment like CPAP machine and diabetic medicines and hypertension, everything medication, this pharmaceutical oriented treatment, what will happen to the patient in the future? He's only 47 years. Naturally, he will, because of the diabetes medicines and uncontrolled, naturally it will increase the diabetes. That is the routine pattern, and the additional medications will be there. The dose of the medicines will be increased. For the diabetes, hypertension and fatty liver, there is not much medication is there because his liver is inflamed already, NASH is there. So the patient, naturally the fibrosis will happen, and there is a possibility that the disease will progress to fibrosis and liver failure or even liver cancer and all. So, and the uric acid is very high, you can get a uric acid stones, urinary stone can develop, and so many complications can arise. And the obesity will be increased. He will be continuing with the CPAP machine. He has to continue the CPAP machine for the lifelong. And definitely more and more future surgeries, because he had already having atherosclerosis. There's definitely chance for heart attack or even stroke, because the carotid artery is also affected. So there can be need for more medication and more surgeries. And he's because of the obesity, the knee problem can, because weight bearing and arthritis will be, that's getting, so the chance for knee replacement, so many surgeries possibilities all will be there. But with the clinically supported lifestyle correction, all this medication is over. None of these complications, future complications need to come. Only thing the patient has to maintain this body weight and body parameters he has maintained. Only thing for that, he should not eat too much, or he should do a basic exercise pattern also. So he should, one should eat only what is needed for the body. If you are taking excess, it will be accumulated in the body. And also when you are eating junk food, you will not be getting enough nutrients. You will be accumulating all the toxins, or even the fat is a toxin actually. If it is excess in the body, it is a toxin. And moreover, his immunity will be always compromised, and the patient will be, anyone who is having a disease or on medication will be a complex patient when you meet a problem like an accident or a viral infection like COVID. If it comes, we know that only the diabetic patient and hypertensive patient, heart disease patient, who are the most affected with the COVID also, the complications and death happened only for those patients who are already sick. So if you are a patient and on medication, you will be always a become a complex patient when you are admitted in a hospital for any purpose, and the chance of recovery will be much lower than a patient or a person without any disease like this lifestyle disease like diabetes, hypertension, heart disease, etc. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting a removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune disease, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicine and 90% of the surgeries can be avoided. It is good to understand that neither medicine nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and the medicines will keep on adding more numbers along with the unwanted side effects. This is why it's very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is, when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thomson, started medical education in Government Medical College, Kochi in 1991 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from the government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications. To protect our children, grandchildren and the coming generations from the ill effects of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle diseases. Thank you.